lot of things. But that extraordinary barriers list is one of them. I look forward to your questions. And my friend Steve Landes, I guess, is going to educate everybody about the money now. he brought several billion.
I don't know about billions, but we have some millions. What I thought I would do is, since I serve as Vice Chairman of the Appropriations Committee and also Vice Chairman of the Joint Legislative Audit Review Commission, I'm happy the commission's going to be looking at how to fund mental health services, behavioral health services. So I want to talk a little bit about the funding, and then I want to talk a little bit about student behavioral health and how we're trying to address that from action we took this year on the General Assembly. And the CSBs and the school systems obviously both have a role in that. First of all, we were, I think, building on what we've done in the past related to budget items, and I also have to thank the mayor for hosting this, and also our two Board of Supervisor members here, Rick Chandler and Pablo Cuevas, because it is a partnership between the state and the local government, and our CSBs can only work that way. And our local governments here have done a great job in providing the resources for the CSB in partnership with the state. And actually the CSBs in the Valley, I think, do a good job. When you compare the CSBs to other parts of the state, we're very fortunate. As Cree said, when you see one CSB, you've seen one CSB, because they're all very different. And unfortunately, some of them are not at the level and providing the services at the level they need to be, but they're getting there. And Cree's Joint Subcommittee and the study that they've done and the work that they're doing will bring, I think, all of them forward. So during this session, I want to thank Tony Wilt and Cree and all those in the General Assembly who supported the budget and the work that we did. We were able to provide about $36.2 million in additional dollars for community behavioral health and substance abuse services for the fiscal year 2020 budget, and it includes about $7.8 million in general fund dollars for crisis response services to accelerate STEP Virginia and what you've heard related to that in that program. And it will be required by utilizing those funds to be implemented in 2021. We also provided about $5.2 million for discharge assistance planning to assist 100 individuals in state facilities to come out of state facilities and transition into community settings, working with CSBs, and I think that's a great investment. We also put additional $5 million for permanent supportive housing for up to 380 individuals. Janet Howe, who is a senator from Northern Virginia, she serves on the budget conference, and I've served on the budget conference. That's a perfect example of where bipartisan efforts in all this has been a bipartisan effort has come together. But that is an issue that she's really been supportive of, and the budget conference was able to accomplish that. $7.2 million in direct care staffing for our state mental health hospitals. Basically, as Cree said, we are seeing an uptick, if you will, of admittance to our state hospitals. When we're trying to move individuals back into the community, we're still seeing, unfortunately, more and more people that need access to our hospitals, usually on a shorter period of time. We're not trying to keep folks there for a longer period of time, but we are seeing a need for additional staffing. I know Western State is a perfect example. In fact, we're going to be expanding Western with additional 50 beds with a new pod, and that's in the works. But that $7.2 million will do a lot with all those 10 hospitals that Cree mentioned. We also had $7.1 million, about $2.6 million in general fund, and then accessing $4.5 million non-general fund dollars for Medicaid rate increases for mental health professionals. That is something we're working on as well, trying to bring those rates up, because if you can't afford to provide the services through the reimbursement rate, it's hard to actually have people being able to access those services. So trying to make an additional investment there. So that's community-based services and what we're doing this biennium. Now let me talk a little bit about the facilities, as Cree mentioned. For this past session, for behavioral health services for our facilities, we're providing an additional $34.5 million. That will add about $7.2 million in 2020 for an additional 254 additional nursing, direct care staff, psychiatrists in our state behavioral health hospitals, and that is to, again, take care of that additional number of individuals who are seeing access services in our state hospitals. We also added about $19 million in fiscal year 2019 and 27.3 in 2020 to transition funding for Piedmont Geriatric and Catawba. One of the things that some of us would like to see is us transition out of those older facilities and ineffective, efficient facilities and moving more dollars towards the community, and that we hope will help do that. But we still need to provide those services until we can accomplish that. Having said that, let me say one of the things that emphasize what Creed mentioned is if we're going to have a truly community-based behavioral and mental health services system in our state, we have to close facilities. We have to make sure we're right-sizing them and build them at the, I think, in a model like we did with Western State Hospital, where we have modern facilities that are flexible, that can take people and then get them back out into the community just as soon as possible, either through medications or treatment programs. But we should not be and should not have, I think, a goal of building bigger facilities and more facilities. We need to reduce the size. As Chris said, that will free up a lot of state dollars long-term for community-based services. So that's the direction I hope that we'll continue to go. Chris said the governor included, and he was at the press conference, that there will, the governor's proposing amending the budget to provide $315 million through the Virginia Public Building Authority for bonds to replace the current Central State Hospital with a 252-bed facility. That would be a great thing, hopefully that we can accomplish during the reconvene session. And again, that facility would be built on a new model, not, if you've ever been to Central State, it's the old model of a huge old campus, very separate buildings, and it really is being held together with duct tape and baling wire at this point. So it's also not good from the standpoint of the services that they provide there for any individual family member who would have an individual that might be there accessing services. Let me also just say, we've concentrated on mainly behavioral health issues, but when we look at, we've also provided additional funding for individuals with intellectual disabilities. One of the things we've also got to continue to look at is moving away from training centers like we have in Lynchburg and the like, and moving again towards community-based services. And that is a tough thing for us to try to accomplish too, because again, as Chris said, where you've got a facility, someone wants to keep those jobs there. But I think most of us believe that we need to, again, transition from that and then move into community-based services for our individuals with intellectual and developmental disabilities as well. Now let me real quickly talk about the importance of what we did, I think, related to school safety, but more importantly, student behavioral health and mental health intervention. One of the things the House did, and the Senate's been very supportive of this session, is we had a select committee dealing with school safety. So we're looking at all sorts of issues for schools and how to secure schools, but more importantly, the most important thing we did, I think, dealt with behavioral health and looking at how we're going to deal with problems that young people are having in schools related to behavioral and mental health issues, and how to get them services. So this is, I think, the starting point for moving and providing additional staff and concentrating on getting services in the school and then working with CSBs. Now, it's the beginning. So what we did this session, one of the recommendations, I actually carried the bill, but we also provided funding to start getting us there, and that is to move our school counselors, and actually we've called them guidance counselors for years, but now we're changing the name so it's school counselor, so they'll actually be using their training and their experience in counseling students. And what we're doing is saying that 80% of their time should be actually in counseling students, not doing other administrative things like many schools have had them do over the years. And it's kind of been mission creep. It's been something that we've seen, and school counselors and the professionals came forward and said, you all need to correct that, and you need to move us back to actually counseling students. School systems were very supportive with that. The question is that how are you going to accomplish that? So what we're able to do in the budget is provide additional money to start the process and start getting the ratio, not only from an 80-20, but to have one counselor for every 250 students in our schools. So that's going to be the goal. Now, we didn't accomplish that all in one session, but we started funding additional positions so that school counselors, we can get to that ratio and to have that ratio from the standpoint of their function and responsibility. Now that's important for two reasons. One, from a school safety standpoint, it will hopefully allow us to start identifying students that are having issues and problems and getting them to services that they really need in the school or in partnering with mental health professionals either in the school system or with local CSBs or private providers, and making sure the parents and student can get to where they need to get the help. Secondarily, we think it's also going to reduce the amount of violence that some students see from the standpoint of acting out against themselves in the case of suicide or against other students or faculty and staff. And I think of all the school safety issues, that is the most important thing that we can do long-term for the health and welfare of our students and staff in our school system. So that, I think, will be a great reform, and that at least is a start. There are all sorts of other recommendations related to securing schools and providing additional funding for that, but that's more of a bricks and mortar issue and how schools approach that. I will say the other thing that this will allow and funding will allow is to partner and have our schools partnering with additional school resource officers in schools. Most of our schools have resource officers now, but again, one of the important things that we hope school resource officers will be able to do is get additional training when it comes to intervention with students and identifying when a student is having a behavioral health crisis as opposed to just acting out or being a bad kid. So those are the kinds of things that we want to continue, and I think we're making a good step effort this year related to that. So as Chris said, look forward to your all's questions. And I am a one-termer at this point because I am not running for re-election in the House of Delegates. So I can say anything and everything.
Thank you both very much for getting this started. This is a community conversation, and I will do my very best to make sure everyone has an opportunity to ask a question of either or both of these gentlemen, and we'll just do it by if you would raise your hand and kind of say who you are so that we make sure it's a friendly conversation that everyone can enjoy. And speak loudly because the room is big and it's hard to hear, and we want to benefit from any question you might have. Sir?